183,000 people are reported to have died from COVID-19, but a new CDC report has caused some confusion over that number.
Health officials say some people are misinterpreting the CDC's data, and they say that could have deadly consequences. WFMZ's Jackie Ferris has our story.
Dr. Tim Friel with LVHN says the U.S. is living through not one, but 3 pandemics: COVID-19, fear, and misinformation. He says the interpretation by some of a new report by the CDC on COVID deaths is proof. The report says 94% of the more than 183,000 people who died had underlying conditions. But check social media and you will see people who read that as only a fraction of the deaths being COVID-related. Not true, says Friel.
This perception that only 6% of deaths are actually related to COVID, because it's the only thing that's listed on the death certificates, is a really, really dangerous and misguided stance.
Friel says doctors often list comorbidities on death certificates, and in the case of COVID, he says diabetes, obesity, and heart disease are frequently listed. But he says even though those conditions hurt a patient's chance to beat the virus, it's typically the virus that ultimately kills them. Friel says COVID misinformation has run rampant for months with dangerous consequences.
People were actually drinking hand sanitizers. People were considering drinking bleach because they heard or misheard that bleach could be helpful in preventing COVID-19.
Friel says it's important to make sure we know the facts about COVID and continue to take proper precautions to prevent it, like wearing a mask, washing our hands, and social distancing. Jackie Ferris, 69 News.